Hi everyone, I'm Dr. Tiffany Dzugan and I'm a naturopath here in the GTA. I currently have two practice locations. I'm in Burlington at Healing Touch Natural Wellness and I'm in Etobicoke at Humber Bay Physio. At both of these locations, I run a general practice, meaning I see people of all ages with all health concerns. What I see most often tends to be pain management, sports medicine, women's health, digestive issues, and mental health concerns, including anxiety and depression. My background is in competitive dance and kinesiology, so I draw a lot from that in my practice. So today we're going to talk about sleep. Natural secrets to better sleep, the A to Z's of getting your Z's. So I want to start off by talking a little bit about naturopathic medicine. A lot of people don't really know what it is that I do as a naturopath, so let's discuss that first. A lot of people have different experiences with naturopaths. Either they've been to someone who calls themselves a naturopath but isn't really practicing as a typical naturopath would, or someone's been to a naturopath, they leave with $600 worth of supplements, and 2 months later they don't really feel any better or any different. So in reality, in Ontario, naturopaths are primary care practitioners. So any concern you would see a medical doctor for, you could potentially see a naturopath for. There are really two main differences. Where a doctor would give you a drug treatment, I would give you a natural alternative. The other main difference is the amount of time we get to spend with our patients. Doctors in the medical system are very burdened by time restrictions, and we as naturopaths have the luxury of having a lot of time to spend with our patients. And it really allows us to get to know our patients better, and I think that improves our success. So those are the two main differences between us and medical doctors. There are lots of tools in the naturopathic toolbox, and I've listed them here on the screen for you. So some of the things that we recommend are treatments that take place in the visit, like acupuncture, for example. Some things are recommendations that you'll do at home for yourself, like nutrition advice or some type of hydrotherapy treatment, which is treatment with water. Other things are recommendations you would go and purchase from a supplement store, for example, high-dose vitamin D or vitamin C if you're getting a cold. So all of these things listed on here are options for what we can draw on to create a treatment plan for you. And this will be a different treatment plan for everybody, even if you come in with the same concern, which is really the great part about naturopathic medicine. Okay, so now on to sleep. What we're going to talk about today is a couple of the main reasons that people have difficulty with sleep, and then we'll discuss some strategies for improving them. I am not a huge believer of starting with a whole lot of supplements or lab tests or anything like that. I like to start off with recommending fundamentals. So that's what we're going to focus on in this video today. And then in a future video, I'll address some of the main supplements that are typically used for sleep intervention. So if the things that we talk about today don't work for you, you might be able to add in something else. Now, a lot of people struggle with poor sleep, and it's unfortunate because a great night's sleep can really set you up for a great day, and a poor night's sleep can really ruin the rest of your day. So great sleep is really important. That's the time that our body has to heal and repair. So good sleep is critical. Now, before I move on, there's a couple of different types of insomnia. So let's just be clear about those before we move forward with some of these ideas. There is sleep latency insomnia, which means difficulty initially falling asleep, and there is sleep maintenance insomnia, which is difficulty maintaining sleep throughout the night. So that would be if you're constantly waking throughout the night. And we treat both of these differently, so it's important to distinguish whether you have one or the other, or potentially both. Okay. So identifying the main reason that you're not sleeping is the first step, because if we don't know, number one, what our goal is, or number two, what we're treating, it's difficult for us to find an appropriate treatment for you. So one thing that I commonly see in practice is pain. A lot of people will say that they kind of push through the pain all day, and then to get to sleep at night, they need a couple of Advil or a couple of Tylenol to be able to fall asleep. So pain is kind of a whole talk in itself, and we can discuss that at some future date. But if you're having pain, this is not a good reason for your sleep to be impacted. So make sure you're getting some help with that. The next thing on my list is your sleeping buddy or sleeping buddies. So if you have a partner who's in bed with you that's snoring or constantly rolling around waking you up, that's a problem. Or if you've got little kids running around the house or screaming for you in the middle of the night, that's a sleep interruption as well. That's something that needs to be identified and helped. The next thing on my list is hormones. Hormones can impact sleep in many different ways, both directly and indirectly. So for example, in menopause, we have a huge drop in estrogen, and this is what causes some of those symptoms. So there is an innate change towards poorer sleep in menopause just with that hormonal shift alone. But there's an indirect relation to sleep also with things like hot flashes, constantly waking you up throughout the night because you're uncomfortably hot and then getting that cold flush afterwards. So these are things that can kind of add a barrier to a good night's sleep. Another way that hormones affect sleep is through cortisol. So cortisol is our stress hormone. It's produced in our adrenal glands, which sit like little hats on the top of our kidneys, and they produce our sex hormones as well as cortisol. Cortisol gets blamed for a lot, but it's actually really important for us to have a baseline level of cortisol. Cortisol is important for helping with blood sugar maintenance or mobilizing resources when we need them. It also helps to decrease inflammation, and it can give you that adrenaline boost that you really need in times of stress. But cortisol also plays a huge role in our sleep cycle. So any issues come in when you have either too much cortisol or too little cortisol. And if it starts to spike at funny times during the day, we can see issues with sleep as well. So we're going to spend a little bit more time on this part next in the presentation. So you can see here that we have a normal cortisol curve. So it's supposed to spike initially right in the morning, like just after waking, and then it consistently drops throughout the day. And notice at about 3 o'clock, there's a little plateau in the drop. That's important for you to note moving forward. So this is a normal cortisol curve. When we compare it to a state of chronic stress, you can see that the dots are consistently kind of higher or on the high end of the normal curve. So our adrenals are working overtime to keep us functioning basically in this time of stress. And the cortisol remains high, and this is when you start to see some sleep disturbance, because when you're supposed to be going to bed, your cortisol is not lowering like it should be. So now we have burnout. And this is what happens with chronic stress, is eventually your body just can't keep up with the demand. So your adrenals are pumping out cortisol, and then they just can't keep up, and all of a sudden everything drops. And you can see that reflected here in this cortisol curve. The dots are consistently lower throughout the whole day than that regular cortisol curve. Some naturopaths like to call this adrenal fatigue. The other word for it is burnout. So this is just a way for you to be familiarized with it. So when this happens, maybe all you want to do is sleep all day, or you might be very tired, and when it's time to go to bed, you kind of get that tired but wired feeling. So you're exhausted, but you can't fall asleep. The other thing that you should make note of is in the mid-afternoon, when you should be getting that sort of plateau in the cortisol curve. This is also a time that can indicate for us if cortisol is an issue with you. So if you feel like you need a nap at that time of the day, or if you constantly need that mid-afternoon coffee or mid-afternoon chocolate bar to get you through the rest of the day, this is an indicator that something could be off in that cortisol curve as well. The other thing that I wanted to mention on the topic of stress is that some people just can't get to sleep at night because they have this really busy mind. And so there's a lot of overlap here with anxiety and sleep and stress and all of that stuff. And a lot of the things that we recommend for sleep are actually also great for anxiety and depression. So if you're struggling with things like a busy mind, the cortisol kind of indirectly relates to that as well. We'll be touching on some strategies for you potentially in a future video. Okay, I wanted to include this great picture because it's a great illustration of how our different hormone systems kind of interact and how a small impact in one can actually affect a whole slew of other cycles. So the thyroid here, as you can see in the picture, does play a role. This also gets blamed for a lot of things, so I don't want to put too much stress on the thyroid here, but it is a metabolic organ and it does have metabolic consequences, so it can affect our sleep cycle as well. The thyroid is a very sensitive organ, so there's lots of different things that can impact it, but that's also a good thing. It means that there's a lot of ways that we can intervene to help with the thyroid function. The other thing to kind of think about is blood sugar. This is not a hugely common reason for poor sleep, but it can play a role, so keep that in mind, and we'll touch on this a little bit in a future video as well. Okay, so what do we do to fix it? We're going to start with the basics here, the basics of sleep hygiene. And I cannot impress upon you enough how important sleep hygiene is. You can take all of the supplements in the world that supposedly help with sleep, but if you don't have these things under control, you're not going to have any success with those supplements. So the first thing to keep in mind for sleep hygiene is making sure your space is working for you. If your bedroom is cluttered, if it's too loud, if it's too hot, or if it's too bright during the night, that's all factors that can impact sleep. So making sure that you're in a nice dark room that's quiet and a comfortable cool temperature for you. That's so critical, making sure that your sleep space is effective for you. The next thing on the list is kind of what we touched on earlier, is your partner helping or hindering? So if your partner is a snorer, then that's something that needs to be addressed for both you and them, and they should really be seeking help with that. Activities in the sleep space is another huge thing. We don't even realize how much we're using our bedrooms for activities other than sleep. A lot of my patients come in and they're doing their homework in bed, or they come home after work and they're doing their emails in bed, or taking phone calls in bed, or even watching Netflix. That's a really common thing. So making sure that your sleep space is just for sleep is so important. It really helps to kind of fix that mindset towards being ready for sleep when you're consistently only sleeping in your sleep space. So the only activities allowed in bed are sleep and intimacy. Everything else should be done outside the bed. Get a reading corner, get a home office, do something to put all of those activities somewhere else, but make sure that bed is just for your sleep. The other thing that you can think about is energy flow. So this is a little bit on the hokey side, but if you think about things kind of cluttering, if you keep a lot of things under your bed, that can really hinder the flow of energy in your room, and that can affect sleep as well. So clearing all the clutter and making sure nothing's stacked underneath the bed. The next thing on the list is a bedtime routine. So yes, you should have a regular set bedtime and a set wake up time generally every day, but there's a whole other aspect to a bedtime routine that's really important. So making sure all of the activities you do kind of leading up to that bedtime every day are the same every day is really important. It's that same idea of setting up your mindset for sleep. So if your body learns to prepare with sleep with whatever sequence of events you choose to do, it will become better at falling asleep. It doesn't really matter what you do leading up to your bedtime routine as long as it's not super stimulating, just making sure that it's very consistent. The last thing on my list is screen time, and naturopaths get a really bad reputation for taking away all of the things that we love, like coffee and chocolate and no screens after 7 p.m. So I'm not here to tell you no screens after 7 p.m., but what I will say is that there is some scientific backing to decreasing this stimulating screen light before we go to bed. If you think about back when we were cavemen, we woke up in the morning with the sunrise and we went to bed with sunset, and that's what kind of indicated to our body that it was time to do those things. So when the sun comes up in the morning, it stimulates melatonin production, and melatonin is kind of our sleepy hormone. So when the sun rises, the melatonin is produced and then it's stored. And the idea is that sleepy hormone is released in the evening when it's time to go to bed. So if you're constantly stimulating your eyes with more of that light, melatonin will keep being produced, but it won't be released like it's supposed to. So sleep onset will be delayed. So there's a few ways that you can kind of combat this if it's not possible for you to get rid of your screens before bed. There's something called night mode on your phone. You can turn that on, and it kind of just changes the color of the light so that it's not as stimulating for you. The other thing I like is on the screen here. It's called F-Lux, and it's a program that you can use on your laptop, and it changes the color of the light that's emitting from your laptop screen throughout the day. So it helps so that it doesn't affect your melatonin production quite as much if you're not able to eliminate those screens completely. The next thing I wanted to talk about is sleep restriction therapy. And this is definitely not an intervention for everybody. It's very difficult to do. It requires a lot of willpower, but it's the best known thing in research. So I figured I had to include it here. Basically, what we do is we start with a sleep diary. So for a week or two, you're just tracking your sleep. What time you're going to bed, what time you're waking up, if you're going to the bathroom throughout the night, how long you're up every time you're awake, and your wake time in the morning. With this diary, we figure out how many hours throughout the night you're actually sleeping. Once we have that number, we restrict your time in bed to that amount of hours. So for example, if you figure out with your diary that you're only actually sleeping for 5 hours a night, then you would set your bedtime for midnight and your wake time for 5 a.m. and you do not allow yourself to sleep outside of those hours. It really trains your body to improve something called sleep efficiency, which is basically the amount of time spent in your bed that's actually sleeping. So eventually your body will adapt, and during all of those 5 hours, your body will sleep. Once you reach that time where your sleep efficiency is 100%, you add 15 minutes on. So you can sleep an extra 15 minutes, and you'll gradually do that, adding 15 minutes at a time as your body increases its sleep efficiency until you reach that regular 7 or 8 hours or whatever it is that you're aiming for. Like I said, it's not for everybody. This is really difficult to do, but I have seen it work really well in some patients. So if you feel like it might work for you, you can give it a go. That's all that I wanted to discuss on this video today. I didn't want to touch on any supplements because I truly feel it's important to fix the fundamentals and really adapt our lifestyles to support good sleep before we start adding in supplements and things. So I will address those in a future video, like I said, but please feel free to comment with questions or requests for future videos, and I look forward to all the feedback. Have a wonderful day.